Hello, my name is Noel Scanlon. I'm the Executive Director of Nursing. Welcome to my first video podcast. Hope you enjoy this new medium. We're going to try and communicate in this way more frequently now, but there's a couple of particular messages I wanted to share with you this morning. The first is never events. Many of you may know that we have declared 8 never events in the Trust in the last. Never events are by definition things that should never happen, breakdowns in procedure that leads to harm for patients. It's not indicative of the excellent care you deliver every day. On the 7th of April, we're running an away day. This is particularly relevant if you're in a specialty that delivers procedural care, either in the surgical or operating theatre or ambulatory setting. Specialties like orthopaedics, plastics, anaesthetics, dentistry, dermatology are all invited. More than 300 staff have already signed up. If you are interested in coming, and I do commend it to you, please contact course bookings in the usual way. The other point I wanted to make today was about the Care Quality Commission. Many of you will remember that our regulator inspected the Trust in February 2015, which means that we're overdue for another inspection. The inspection regime has changed since that time. They used to give us 100 days notice. Now they will be arriving unannounced and visiting specialties that they've had an interest in because of the intelligence they've gathered in recent months or years, and perhaps doing follow-up inspections in specialties like paediatrics and maternity and surgery. But for the reasons I've already mentioned around never events, I think we can be fairly certain they'll take a strong interest in surgical safety as well. CQC inspections are nothing to be afraid of. The inspectors are mostly jobbing doctors, nurses, therapists, scientists, and healthcare managers just like you. They want to portray the Trust in the best possible light. Of course, they have a responsibility to the public to shine a light on areas of weakness, but it's also an opportunity for us to shine and demonstrate all the things we do well. They won't get in the way. They are there to observe. They will have gathered evidence before they've come. But it's highly likely that you'll also be asked questions about your practice and your place in the organisation. So here's a few tips, things that perhaps you might want to think about so that when they do ask you the question, you don't freeze. When did you last have an appraisal? How do you keep your knowledge and skills up to date? Are you aware of any never events or serious incidents that have affected your department, or which have caused you to change your practice? When were you last involved in a complaint or compliment about your service? And what did you learn from that? And if you're a clinician, did it contribute to your professional portfolio for revalidation? These are simple things that most of us take for granted, and when confronted with questions by people from outside, we perhaps freeze. And we needn't do that. Do a little bit of preparation, speak to your line manager, engage with your team. The communications department are putting out a range of materials that help you reflect on and remember things like the vision and values of the Trust, which we live and breathe every day: caring, commitment, honesty, integrity. But at the same time, for our regulators, we do need to demonstrate how we deliver those to our patients. We need to show that our services are safe, caring, responsive, effective, and well led. Thank you very much for listening to this podcast. I hope you found it useful. We'll be doing this again in the future.